Well, hearing loss is more common than you think, and it's not just a problem caused by age. Your work environment, your music habits, even genetics can affect your hearing. So how do you protect it or even regain what you've lost? It all starts with a visit to the audiologist. Now, Paige Parker is an audiologist here with me from Hearing Health Solutions. Thanks for joining me, Paige.
Thanks for having me.
Okay, so we are in the midst of Audiology Awareness Month, the perfect time for you to explain your specialty. So what is it that an audiologist does?
Yes, so an audiologist is a healthcare provider, and we try to evaluate each patient and diagnose and treat hearing loss and also balance disorders.
Okay, so what type of education and training do you get to become an audiologist?
Yes, so currently, since 2007, the entry-level degree to become an audiologist is a doctoral level degree. So if you see a provider who has graduated since 2007, they'll have a doctorate in audiology. And then prior to that, it was a master's degree. So you may see someone with a master's, you may see someone with a doctorate.
So you have to be really smart and go to a lot of schooling, I think.
Yes, we went to a lot of school. Contrary to what people believe, we studied a lot to do this.
So then let's talk about the primary focus and your goals. When you see a patient, what is it that you're looking for, and you know, what is it that you do on the daily?
Yes, so as an audiologist, we really look at the whole pictures. So our ears gather sound, but we really hear with our brain. So an audiologist's kind of role is to evaluate the whole hearing system and identify where the problem is. Most of the time, the treatment for hearing loss is hearing aids. And so we can kind of go that route. However, there are some other causes of hearing loss that need to be identified and treated by an ear, nose, and throat physician. And at Hearing Health Solutions, we work closely with Ohio ENT allergy physicians, and we can collaborate with them to kind of work best and see what treatment may be best if a hearing aid isn't the right first option for them.
I will say my son has had 2 sets of ear tubes through them. So I know that, yeah, dealing with the ear, the nose, the throat, everything that connects, it's interesting. And I imagine working together with them as a team as well is just a benefit for the patient.
Exactly. And it's really our job to identify, because some people think that they have hearing loss and it may just be simply fluid in the ear or wax. And so we really want them to come in, see a professional, look at the whole system and identify where is the problem and see if we can treat or fix that problem.
And let's talk for a moment about causes of hearing loss then. If somebody is experiencing that, you know, what do they do? I guess, how do they know if it's something that's temporary or if it's something that's only going to get worse?
Right. So we really recommend anytime a patient feels like they have hearing loss, come in and get a simple hearing test. There are sudden hearing losses, and that's a big thing. If you wake up one morning and you can't hear out of one ear or both ears, don't just wait and see if it goes away. Come in and get attention. There are such things as sudden hearing losses that need to be treated sooner rather than later. Also, wax in the ears. So some people think that they clean their ears out themselves when they really need to be seen by a provider, and that can be a simple fix. There can be fluid in the ears, a lot of times with kids, but we do see adults with fluid in the ears as well. And then most of the time it can be nerve damage. So age-related, noise-related, someone with a lot of noise exposure, or just genetic markers can cause a hearing loss. And with that type of hearing loss, most often the treatment is hearing aids.
And so, Paige, when we talk about hearing aids, how does somebody find the right fit? I feel like this isn't something you can kind of go online and say, okay, this one works, I'm going to take it, right?
Exactly, exactly. So you come in and you meet with a professional. So we want to evaluate the patient's quality of life. So most often, you didn't lose your hearing overnight. So we can't fix it overnight. And like I said before, we hear with our brain. So you come in, you talk with a professional, we get to know kind of your daily lifestyle, where you have trouble hearing, where you want to hear better, kind of what your daily listening life is like. And we take that and we talk about all the different options. So the different shapes, styles, colors of hearing aids, there are plenty. And we kind of talk about technology options. So now there are Bluetooth compatible hearing aids, which is pretty fun, rechargeable hearing aids. And we really talk with that patient to see what fits your quality of life best, what's going to improve that hearing wise. And we also do a trial period. So you're not stuck with whatever you decide at first, but it's really best to work with a professional to see what works best for you and to make sure you're getting the right amplification and right treatment for your hearing loss.
And I imagine these changes can be dramatic, if not life-changing for your patients.
Exactly, exactly. One of my favorite parts of my job is educating patients. So letting patients know, why do you struggle in noise, but you do fine one-on-one? Or why does this hearing aid help you hear conversations better? And I really enjoy seeing patients in my office realize they didn't realize what they were missing, and now they're getting that back again. It's really nice.
Exactly. Okay, Paige, again, with Hearing Health Solutions, you guys have locations across Central Ohio, so you can go to the website to find one near you and get started. Thanks again, Paige.
Thank you.